I lead the clinical and research program for bowel cancer at Peter MacCallum, and is also a senior research fellow at the Walter Eliza Hall Institute of Medical Research. And both the institute I work with really are co-located within the Parkville precinct in Melbourne. So over the past 12 years, my research program really pioneered the use of a form of liquid biopsy known as circulating tumor DNA, or ctDNA, which are small fragments of tumor DNA shared by cancer into a patient's bloodstream. And this is used to detect subclinical, microscopic or occult disease in bowel cancer, and has fundamentally redefined how we assess relapse risk in solid cancers. With this project, we want to demonstrate that tumor DNA detection in peritoneal fluid collected at the time of primary tumor resection of non-metastatic clinical T4, so locally advanced bowel cancer, can accurately detect subclinical disease and predict for future peritoneal recurrence. So this will be achieved through a multi-center prospective observational study. We'll call it the DETECT PM study, and we'll collect and analyze tumor DNA in the peritoneal fluid and cytology as well from the peritoneal cavity of 100 participants recruited from 12 Victorian hospitals. And eligible patients include those with clinical T4 perforated bowel cancer undergoing curative intent surgery of the primary tumor. This study will include 3 Ramsay sites, Warringal Private, Peninsula Private, and a regional Ramsay site, Albury-Wodonga Private. And I anticipate that peritoneal tumor DNA detection will be highly predictive of subsequent peritoneal recurrence, and will be more sensitive than blood tests and our standard cytology at the moment, and really opening a window of opportunity for earlier treatment and intervention to prevent peritoneal recurrence, improve patient survival and outcome. The motivation behind this project is that despite curative intent surgery and chemotherapy given after surgery, a significant proportion, around about 15% of patients with locally advanced colon cancer do develop cancer relapse in the peritoneum. So these are the lining in the abdomen. And while tumor DNA detection in the blood, the ctDNA, is highly predictive of recurrences distally in the organ, in the liver, for example, its ability to detect peritoneal relapse or small peritoneal metastases is very limited because of the peritoneal plasma barrier and the different mechanism of disease spread in the distant organs versus in the peritoneum. The 2 main really factors prompted my research to diagnose peritoneal disease early in the subclinical micrometastatic stage. Firstly is our struggle really to control peritoneal metastases once these are established, and we can see them. The patient with this disease type have extremely poor survival, with average survival only less than 12 months, and are typically poorly responsive to conventional chemotherapy. And secondly is our limited sensitivity of current imaging method for early diagnosis. So really, I think we're hoping that detection of peritoneal disease in a subclinical stage will provide a much needed opportunity for earlier intervention to prevent disease recurrence.